Welcome back to Fox 10 News at 4. Lung cancer is the second most common cancer for men and women. We are committed to making sure you know and understand the facts associated with this disease. So we've got Dr. Brian Persing, a medical oncologist with USA Health. He is here. We appreciate you stopping by to talk more about the care and treatment. But I guess the first question is screening, because whenever it comes to cancer, you want to catch it quick.
Absolutely. So the biggest issue we've had in lung cancer is we really haven't had a very reliable screening test. About 5 years ago now, there was finally a study that was published that demonstrated improvement with CT screening. And what they do is they use a low-dose CAT scan to try to help identify lung nodules early. And right now, the patient population that's included in that trial are people kind of between 55 and 80 years of age, typically more than what we would describe as a 30-pack year history of smoking, which would be 1 pack per day for 30 years or 2 packs per day for 15. And then also they have to have smoked in the past 15 years. If someone more than 15 years, the thoughts are the lung cancer risk is actually dropping down by then.
You know, speaking of smoking, a lot of people, when they hear and think lung cancer, that's the first cause that they think, but it's not always caused by that, correct?
No, not at all. In fact, if you look at it, about 25% of adenocarcinomas are in people that have never smoked. And we now understand that between 5 and 8% of lung cancers every year are even attributed to secondhand smoking. We now know exposure in the workplace, radon, asbestos, all of those can contribute to the risk for lung cancer.
So we've talked about the importance of screening. What are the treatment options available? Is this a multi-treatment attack here?
Yeah, absolutely. So one of the most important things that's been identified in treating patients that have been diagnosed with lung cancer is a truly multidisciplinary approach. That multidisciplinary approach requires a surgeon, a radiation doctor, pulmonologist that can do the appropriate biopsies, CT, radiologists that do CT-guided biopsies, medical oncologists, and that team typically meets together and tries to come up with the most appropriate plan for the patient.
How has immunotherapy helped with treatment?
It's revolutionized what we do in lung cancer. You know, molecular treatments which really target the Achilles heel of the cancer, but also immunotherapy has made an absolutely blistering improvement, and 4-year survivals exceeding 30 and 40% even in stage 4 disease. And it's really, it's given us an opportunity to allow patients to have more time, but also quality time.
And I understand that you guys have a new procedure. Can you elaborate a little bit more about that? It's a robotic procedure?
Sure. So there's actually 2 robotic procedures that have kind of come to the forefront. One is a robotic resection, where a surgeon will use the robot to do resection. The other one is actually the Monarch, which is a robotic bronchoscopy. A bronchoscopy is where they go down the windpipe and get out to the cancer kind of from the inside. The robotic bronchoscopy can use, because they're not dependent on a physician or a person needing to drive, the robot actually helps with the driving side of it. They can drive out with almost an Xbox controller and get out to these very, very small nodules out at the periphery of the lung and get tissue for us at earlier stages. We used to have to wait for sometimes months for them to grow large enough for us to be able to biopsy them. And now that we can catch them when they're smaller, we can offer better therapy and earlier therapy.
Wow, thank you so much for stopping by to share this information. Very encouraging in the fight against cancer.
Yes, thank you.
All right, we will try to get that interview posted for you after this newscast to our YouTube page. That way you can watch it and share it with someone you know.